My full name is Rameshwari Tumuluru, and some people call me, many of my colleagues and all of my patients and staff call me Dr. T. It's much easier, I think, for them. Um, and I think I'm more broadly known with the initial of my last name than even the full name. Um, and and some people call me Ramu, which is the shortened version of my first name. And it's a funny thing, but once in a while, when someone calls me by my full first name, I think, oh my, I do have a full first name. So even in India, people used to call me Ramu. So, but most of the time they used to call me my full first name. But I think now it's just Dr. T. So I've been thinking about that, because I think there is so much uh, discussion about who you are and your identity. And I never used to think about it that much, but I think I have multiple uh, identities. So I guess quite intersectional. Um, I am a South Asian female, um, and I'm a Hindu, a practicing Hindu, and I identify with the she and her pronoun. I'm married, um, heterosexual, married. I have 2 children, and how do I identify myself? I mean, I identify myself with several things, including being a child psychiatrist, uh, first a human being, uh, then as a South Asian Hindu woman who's married and a mother, and a child psychiatrist. I think they're all important. And I don't want to pick one over the other. When people hear this, they'll think she picked something first. Does it mean she only identifies as that? I wouldn't say that, because in these spaces, you would think that I would just say I identify as a child psychiatrist, because that would be a disservice. Because I don't wake up every morning and say I'm a child psychiatrist. I wake up every morning and think I'm part of the human race. I'm a human being. So I think all these other things are part of all of that. So it's quite diverse, my identification. Um, and as far as my career focus is concerned, um, I truly enjoy being a child psychiatrist. And now is a great time for us to kind of think and rethink what we want child psychiatry to be and how it should be. There are several reasons. One, the mind-body connection is quite important. Um, whether you have a headache or a stomach ache, or you're suffering from any kind of cardiac illness or any metabolic condition, the connection with how you are adapting and dealing with all of these conditions, and how your inability to manage these conditions related to mental health concerns has been fascinating. And I was always interested in understanding more of how the brain worked. So it was automatic to kind of think about either neurologic or psychiatric as it. And psychiatry was much more interesting. Um, it's fascinating to kind of think you can talk to someone and really try to figure out what's going on while you're still considering the entire body. I think that's really fabulous. when I started my career as a child psychiatrist many years ago, I started as an examiner for the American Board of Psychiatry and Neurology as a board examiner. So in those days, we used to do the oral boards. So I was an examiner for the child boards and then for the adult boards. So a good part of the time was spent doing that. And then I slowly became involved with the ACAP and some of the committees. Um, I think before that, I was involved in doing some, like developing my own career and working more locally in the department in terms of uh, developing your own career trajectory. Uh, but I was always interested in doing more committee work. And prior to that, the work was more presentations and, where do you kind of put a poster or do a presentation or things like that. Um, so the two committees that I became involved with, one was the inpatient residential and partial hospital committee through ACAP. And then I was also attending the DNC committee meetings and talked to Dr. Al-Mateen, and she was then in the process of rewriting the curriculum for the trainees for child and adolescent psychiatry through the DNC committee. And I told her I was very interested in doing that. So after that, it was a very rapidly evolving connection through her and the committee, doing a lot of work. I was always interested in the diversity, equity, and inclusion issues. And within the child psychiatry department I'm in for the fellows, I organized a workshop because there wasn't much in terms of training years ago. And I created the first workshop and created more of the curriculum for them. And now it's taken off and it's gone on to a different trajectory, but I'm still involved in the cultural competency courses that I had started. But I became quite involved with the committee through the DNC committee in terms of the cultural competency course, and it is now on the website. The educational curriculum, it's on the website. With myself and a couple of others, we wrote that. And then I've been working with several members of the committee doing presentations on DEI issues. And then I also became quite involved with DEI issues here in the department. So I'm doing a lot of work both locally here as well as nationally. But even before that, through our tempo, I felt that there was a lack of understanding of mental health needs in the South Asian youth. So I was talking to people in my community through the tempo to see how we could educate the young people and their families. I did meet with some resistance because it's very stigmatized, the issue of mental health in South Asian communities. So it was something that was hard to kind of overcome. But in more recent practice, it seems like it's a lot more acceptable. And I unfortunately have also observed an uptick in children of South Asian origin who are seeking treatment. The second thing I was involved in through the ACAP was the inpatient residential and partial program committee, which predates my involvement with the DNC committee or almost at the same time. And they did not have anything written or discussed about partial hospital treatment. So with their support, I created a national survey to understand partial hospitals, and I collected a lot of data that I presented, which we are in the process of writing up to create what are the guidelines for partial hospital treatment. So that's been some of the work that I've done through the national committee. But here, where I work, I've been in the department working the acute partial hospital programs, which I was part of sort of developing. and it serves as a hospital step-down and diversion program. And we treat very intensely ill children and adolescents. And I've observed the increasing acuity of the children in the last 2 years since the pandemic began. And so I'm involved in the issues related to PHP nationally and here as well. And during the pandemic, when this entire program was virtual, I created a telehealth toolkit for my staff, um, so that we could come up with plans of how to best treat our patients online. Um, and it was very interesting to kind of think about how to do that. Um, so these are the two spheres I've been involved in terms of the academy. I think as a person who is an immigrant, which is something I did not mention as part of my identity, um, and I should add that because I'm not native born. Um, it's somewhat of a challenge when you have so many intersectional identities, including that of being an immigrant, that you are faced with some challenges when you train in a new country. Um, and But I think they were all only formative, and some of them were tough. But I think they were important in terms of developing some resilience while facing some of the difficulties that many folks face who have multiple intersectional identities. Uh, but I still consider myself as somewhat privileged because there are many more who have dealt with a lot more than I have. I think it's a very exciting time to be a child psychiatrist, but also somewhat challenging um, because we are facing a mental health crisis, and we see a lot more sick children and a lot fewer um, ancillary people treating them, including therapists. There is a shortage everywhere, and the demand for services and the resources are not aligned. And the overwhelming stigma that our patients experience has not decreased in the many years that I've been in practice. I think it still exists. And I think more recently we've had, when we used to treat patients, we used to give them diagnosis of depression and anxiety and psychosis and bipolar disorder. But the child psychiatry system has evolved, and we also have children who are also experiencing some changes in terms of who they are and their developing identities. And more recently, the issue of the LGBT community and transgendered youth, they have increased. It wasn't something that people used to know or talk about as much even 5 years ago. I think we have many more children um, who are identifying earlier with LGBTQ identities and issues. But neither the science nor treatment has, exponentially increased with the identification of the patients. And I think a lot more work has to be done in terms of educating everyone about children whose evolving identities and the parental lack of parental resources, and more recently the pandemic has had a huge impact on mental health of these children, and we are still trying to figure things out. But the children are not waiting for us to figure things out. They want us to do something. And so we need to be able to think on our feet and think outside of our own comfortable space and outside of the box, so to speak, um, and create something that will be very helpful to them. Uh, so I don't know what that is, but I think we are sort of meeting the challenge, I think. I think immigrants, and as such, I too face this challenge. One, whether when kids and parents would often comment about your accent or would wonder if you could speak the language or question your credentials, um, and uh, and often wondered about your religion and if you would understand theirs. And but I think by and large, kids are pretty interesting because they're a little bit more accepting sometimes. They ask the question, and once you've answered it or you kind of figured things out, they kind of sort of move on. I think it's sometimes the adults around them, I think, who have a little harder time. Um, but they too, I think, have overall uh, been accepting. But it's not to say that you don't have negative experiences of comments they would make. Um, of course, now they are defined as microaggressions. Um, and you sort of kind of have to sort it out as them being naturally curious, and you answer the question, uh, and then we kind of come back to the issue that they're there for. And the one thing that I've always um, said to everyone around me, my patients, is I'm going to be treating you with respect, so I would hope that you respect me as well. We don't have to always agree, but we need to kind of work together to kind of move things forward. Um, and I think that seems to have sort of helped me. But it's not to say that you don't privately, uh, uh, experience some sadness or even some emotional thoughts about how you're being treated, uh, or even welcomed or not in certain spaces. Uh, but I think you find your own way and your own place, and you kind of move forward. I had a lot of people working with me. I could never entirely say that this is, there's no I when we are doing some of the work, particularly with the DEI work, Um, I don't own diversity. I'm part of it. So there are a lot of people working with me. And I think along the way, I've had several people who mentored me, um, even in my residency and definitely in my fellowship. Um, and Elizabeth Weller was one of my mentors, and she's late Elizabeth Weller. She's deceased. Um, and she was a very famous child psychiatrist and quite active in ACAP and years ago. And Mary Freistad, she's a psychologist at Nationwide. She was my mentor. I'm not there anymore in Ohio State. And there were several others. Even here, I have found mentors where I met at the University of Pittsburgh who have helped me. Um, and I think the important message is I think you need to kind of talk to people and figure out with whom you can get the support you're looking for, um, so that you can run things by them.
Absolutely. So it seems like for your support, it's been a lot of great mentors. But one of the things I want to highlight is you said interdisciplinary mentors, so not just psychiatrists. And I think that that is something worth noting.
Yes,
Um,
not all my mentors were physicians. In fact, I work with a mentor right now, Ben Handon, and he's a psychologist. Um, and my other mentor was Marika Kovacs, also a psychologist. So I can't really say that all my mentors have only been physicians. Um, and there are others I've talked to, like Cheryl Albertine has been quite influential in supporting my growth in the DNC committee. So I have to say that she too has been, in some ways, been a mentoring presence. Um, and Dr. Balcazar, she's very supportive um, in any endeavors that you have. So I would say that along the way, you meet people you work with. There are some you work with better than others. Uh, and there are some you feel like you don't think you can work with them, and that's okay. I mean, such is life, right? I don't expect to work with everyone well. You try to, and then you have to figure out how best to kind of use your skills. As you tell the children, you have to use your skills to kind of get along with everyone and see how you can work and kind of address the differences. Experiences of seeing how the doctors are well received and are important um, in your communities. And growing up in my family, I'm the only physician at my family, and women were not always highly educated in some communities, not all communities, but in some. But I think I was given the opportunity to uh, better myself and, go to medical school. So I have to count my blessings regarding that. As much as we are going forward and looking at what's going on with the brain, we're also kind of going back to kind of the basics. We are still talking about the use of alternative methods of treatment, including mindfulness, looking at that mind-body connection. I think we are still doing that. And kids are also interested in other things. They're also interested in music as a means of helping them, and creativity to help them with overcome some of their difficulties. And we can't really completely ignore the future use of computer technology and digital platforms to reach our patients to treat them. Years ago, I would never have thought that I would see my patients who have autism and developmental disabilities on a computer frame. But since the pandemic, the parents and children are much more comfortable reaching me through a telehealth platform, which was um, the crisis created a solution and an opportunity that has been very beneficial to many of my patients. So I think we need to create opportunities from the adversities that have been created for us. Um, and so I would say that uh, I think we need to exploit more the digital platforms that our children are utilizing. And we need to understand more of how we can make that work for us. And the use of artificial intelligence and machine learning is right there. It's being utilized everywhere. And, psychiatry may be utilizing that even more in the future. And I think we should all be aware of it. But there is something to be said about the the opportunity to sit with your patients and talk to them and figure out what's going on. I think the art of psychiatry should not be lost on us, nor should be the interpersonal interaction we have with our patients. I found that even though I like the telehealth for some of my patients, almost all of my patients in the partial program are in person and they actually enjoy it a lot and they do better because We are social beings. We want that interaction. Years ago, I would have said you need to work hard and, I would still say that work hard, find your passion, explore all opportunities, and don't give up. It seems like an insurmountable task sometimes to after high school to go to undergrad and then medical school and then residency and fellowship. It seems like a very long, steep path for kids who just want to press a button and get everything. But unfortunately, language cannot be kind of packaged in a pill and is swallowed, and you just eventually suddenly get all the knowledge. Even Star Trek did not discover that in any of the episodes I've seen. It's only that they had pills that became food, but not knowledge. So I would say that you still have to go to school and get an education, but don't give up because I think it's worth it in the end.